Hi, welcome everyone. This is the SnapMD demo presentation. We're going to walk you through our capabilities today and guide you through three interfaces within our platform. The first is the patient interface. So we're going to start with this interface as the patient login. Then we're going to take you through the provider interface and end with our administrative interface. A SnapMD platform is very easy to use. As you can see, our platform is white label, so we use your brand, your logo, your colors. This way we have seamless patient engagement. They are familiar with your brand and your organization, and continuity of care and services are provided as a result. The platform is very easy to use. It's a device of choice. The patient can use their mobile phone, iOS or Android, their tablet, iOS or Android, laptop or desktop. As long as they have an internet connection, they can engage in a virtual consult. We also make it further convenient by providing two language choices. First is English, the second is Spanish. You can see the platform converts to Spanish, so if the patient is more proficient in reading Spanish, they can proceed in that manner. I'm going to log in. This is a HIPAA and high-tech compliant platform. We have the convenience of family accounts. So as you can see here, we can create a family account. I can add dependents, I can add caregivers, I can add parents, whomever you'd like, including babysitters, can be added to your particular account. We have a lot of features and functionality that you can enable or disable in this platform. Based on your workflow, for example, you can engage patients in urgent care by doing an on-demand visit, or you can engage patients in chronic care follow-up by doing a scheduled visit. I'll demonstrate a scheduled visit quickly. We have flexibility in this platform to configure certain visit types. This is your choice. You add the drop-down boxes. As you can see here, we have flexibility to choose certain dates, certain times, and certain providers. So you can schedule appointments out in advance, and you can also, in this particular view, schedule an appointment now. So even within the scheduled appointments, you have flexibility to choose now or schedule for the future. There are a lot of features within the platform that are available. You can engage a patient in video, audio, chat, or even schedule in-person visits. These features can be turned on or off, so enabled or disabled, according to your workflow. If you'd like to provide the patient a choice, you can show all four, and the patient can choose or select how they want to engage in the visit. For today's purposes, I will select video, and we'll demonstrate a video consult. At this point in time, I would like to start my visit. It's a very simple process. We have the ability to offer an intake form. This intake form is optional, or if you'd like to ask questions to the patient, you can create your own questions and drop-down boxes. So for a demo account, you can see there's a wide variety of questions we are showing you today. It does remember if you've been in here previously, so you do not have to answer the questions each time you come in. Again, you create the questions, you create the drop-down boxes, you can ask as much or as little of the patient in advance of the consult. We also have the ability to capture consent to treat. This is electronically captured for your records and documents the patient consents to a virtual visit treatment. Right now, I'm going to proceed to the visit. And in this particular area, what I can do is go into a waiting room, and then there's a queue. At this point in time, what happens is the provider receives a notification that the patient is in the queue. I also have the ability to chat in this area. The chat will be delineated as a chat within the waiting room. And then if we continue the chat, will be carried over as part of the post-encounter documentation, and I can also continue this chat in the virtual console. At this point in time, the provider is going to review my record, review my intake form, and pick me up in the queue. So I'm going to turn it over to the provider interface at this point in time.
So I'm going to show you guys the provider side. Once again, I'm just going to log in from the home screen to the provider. I've been here before, so it remembers my username and password. And the first place it's going to drop me is directly into my queue. We designed it this way so that the physician or the clinician doesn't have to hunt around for their queue and try and figure out how to get there to see who's waiting to see him. If I have a scheduled appointment, it'll show here, and that's where Michelle popped up. If I had an on-demand visit or patients waiting to be seen on demand, they would be down here. I see Michelle sent me a chat message. I'm going to see what Michelle said, and I'm going to reply. The nice thing about our chat feature is that all of this conversation, even when you're in the waiting room, will be included in our post-encounter report. So at the end, we'll show you where those are, but all the chat messaging, whether you're in the queue or actually in the visit, will show up, and it shows whether you were in the queue or in an actual visit with a clinician. I can look at Michelle's profile from here if I wanted to. I'll show you that in a different place, but there's a lot of things you can do from a lot of different places in the platform. It's very user-friendly. We get many awards and comments from our clients that say how easy it is to use and train their physicians and patients to use the platform. So you can look at the profile. I could see what Michelle's primary concern is here. I could look at the chat messages from here. I can see that Michelle's been in the waiting room for 2 minutes and 57 seconds. And I'm just going to go ahead and get Michelle started since she's been there for a while. I'm going to hit start. It's going to run some technology checks to make sure that my connection is good. Doing the same thing on Michelle's side. There I am. Hi. Hello, everybody. And there's Michelle. Hi, Michelle. You look great today. Thank you for seeing me through our telemedicine platform.
Thank you.
And I'm going to show you some things that the doctor can do. I can look at Michelle. I can look at the intake form that Michelle filled out on her way in. I can look at Michelle's profile. I can look at any messaging we had. We have a SOAP note that's available for the doctor and clinicians to actually document in. I'm going to put a couple of things so that you'll see what it looks like in the post-encounter report. And then most of our doctors, I would say, document directly into their EMR, but we do have some that love our SOAP notes. They were all trained on how to use SOAP notes, so they really like it. And they can use it if they want or not. Our platform is fully configurable, so a lot of features we can turn on or off depending on what's important to the practice. You can e-prescribe from our platform, and you can also share files. This is a really popular feature that we have. Our customers can share files with their patients, and the patients can actually share files back. And when let's say a clinic put maybe post-procedure instructions in a patient's file, it will actually send the patient a notification that they have a new document in their file, and they can log in and look at that. We have the ability to take a picture of Michelle on screen. We have the ability to annotate. I'm going to just draw a little circle around Michelle's eye because she's maybe got pink eye, I think, today. You actually look really great. So we have the ability to do shapes and add a little text box. I can put a text box that says Michelle has pink eye. in this eye. I'm not a doctor in real life, so I could then take a picture of this, and it'll become a part of the post-encounter report, and we'll show you that later. Let me clear all that out. And then it goes back to just Michelle, and I can keep up with the visit, and I can say, Michelle, I just think you have a little pink eye there in your right eye, and I'm going to prescribe some cream for that, and view the settings from here. I can change cameras if I wanted to. So if you had an otoscope or a dramatoscope that you wanted to utilize, if you had a patient presenter on the other side and they wanted to show maybe what lesion on the skin looked like, or the inside of someone's ear if they have an ear infection, we have the ability to integrate with those kinds of peripherals. And we also have the ability for them to use a separate microphone if they want to. And we also have a dedicated stethoscope channel. So if they wanted to connect a digital stethoscope to where the patient was, they could do that here, and the clinician could hear the stethoscope sounds remotely. So that's how it would go here, and then they would click on where the stethoscope is. This is just some connection information. If you're having trouble with your call, maybe your IT people would want to see that to try and help improve the quality of the call based on internet connection and those kinds of things. You can share your screen. Anything that you have up on another screen, you can actually share and show that to the patient in real time. So you might have lab results, and if you have lab results, you'd be able to show those here. You can invite additional participants into the visit, and you would do that here. You can invite family members, maybe another member of the patient's care team, and you just do that by typing in either their email address or a mobile phone number, and they will get a message. They just click on a link, and they will be brought right into the virtual visit. And we actually keep track of when the people join the virtual visit, so that for HIPAA, you'll see that in the post-encounter report if someone was to join the visit, when they came in, when they left, and the amount of time that they were actually in the virtual visit. They cannot see any patient information. They can actually just see the visit part. So for HIPAA, that's actually very nice. You can share imaging too. So if you had maybe your PACS or your, a radiology imaging up on your other screen, you could share that here, and you can document on that. I can take my self view off. I can turn my video off, and on here, mic here, speaker here, or I can take Michelle to full screen. And what's nice about that is for our maybe our mental health clients, they like to see their patients in full screen and not be distracted with their own picture. Go back to my own. That is the virtual visit portion. There's lots of features and functionality. One of the reasons that we get such recognition in the industry is because we are feature rich, and they are configurable. So we like to say we're highly configurable. We're not customizable, but we can turn features and functions on and off with sliders so that the platform becomes exactly what our clients need for their business, for their practice. So I'm going to end this here, Michelle. Michelle, do you want, and then I'm going to mark it as complete. You can mark it open, and that will keep this documentation open for 24 hours if I wanted to come back and maybe add something to the documentation if I had to run off to another visit. I could leave it unresolved. Unresolved is usually, for example, if the patient got dropped, the call got dropped for some reason, and the doctor wasn't able to reestablish the visit, they might leave it unresolved. And then you can mark it complete. I'm going to mark this one complete. And it's going to take me back to my queue. So if I had anybody else that I needed to see right now, they'd be right here in the queue, and I just start that next visit. But I'm going to have Michelle take back the screen for a minute, because I want Michelle to show you what she sees when the visit ends.
Yep. Okay, so what you see here is our post-encounter summary. We capture the patient information, all the encounter information for your reporting capabilities, and also we can view a copy of the post-encounter report. You can see you can download, print, save as a PDF, upload, share over to your EHR. There's a wide variety of things that you can do with your visit summary. It is a comprehensive summary of all the patient and clinician statistics. If there are any SOAP notes, they would be captured here. If there were any prescriptions, and we do have the ability to e-prescribe within the platform as an optional service, that would be also pulled over and captured. The chat you can see is delineated what was taking place during the waiting room versus what took place in terms of conversation during the consultation, if any. And then we also capture all the information on the patient intake. So anything that's captured in addition to images that are saved. If there were other attachments such as weight loss management, a diabetic diet, they could be attached here and also would be part of the post-encounter report summary. I'm now going to turn it over to our admin interface, and we have one of our other team members who are going to walk you through that those particular features and functionality.
Thanks, Michelle. Okay, so what we're going to do today is to walk through the admin portal. So after an account has completed configuration and we turn over the account to a client, oftentimes the remainder of the account configuration will take place within the administrator interface. So we'll talk about some of those items here shortly. So I'll go ahead and log in. And once I do log in, I'm automatically directed to my dashboard. One of the many ways I can access different functionality within the platform by tapping on whatever card wall here item is that I want to be able to access. Otherwise, we do have the ability to access those features as well in the top left corner by navigating to the hamburger menu. A couple of things here that are important to point out is that we do have a help center, which is in each interface provider, patient, as well as admin, with help articles, videos, and how-tos if needed, as well as access to how to reach our 24/7 support center for assistance. You also do have the ability in each interface to do a connectivity test to ensure that your audio and your video in your device meet our current standards before actually entering into a consultation. Otherwise, let's go ahead and start with the dashboard. We're going to talk about what takes place in each of these card wall items, starting with the staff accounts button. And that's where we can go to either create a new staff member, filter our view of our staff members that are in the platform. Also, one of the many areas where you can schedule a consultation, or if I needed to edit a current staff member, where I'd be able to tap on their name and come into the platform, select edit, and modify any of their contact information, address, number of years in practice, as well as where I can see previous activity for consultations that they've completed. Again, one of the many areas where I can see where upcoming appointments are scheduled, any files that have been exchanged with that particular provider, their licensing region, as well as any organizations, locations, or groups that we might want to assign the patient to in order to establish any workflow rules for being able to filter patients to the appropriate providers based on specific data points, whether it's a home address, whether it's a reported location for the patient for the time of service, or whether they're within that provider's licensing region, part of their organization, or part of a group. And we'll show you where that's at here in just a few moments. Again, moving from left to right, you can see our navigation bar move to the top of the screen here. So we'll just continue to the patient portal. This is where we are able to add new patients, and very similar to the provider and staff accounts button, where we would be able to either filter our view on the left-hand side of the screen. You can see a little bit more there where we can filter our patients by, for viewing capabilities, and to be able to select a patient in order to modify any of their information. So again, coming in here, selecting edit. Once again, one of the many areas where we can schedule for an appointment and where we can see additional information that's been captured as part of the patient's registration process. And much of this information is configurable on the back end when you walk through to configure your account initially within SnapMD. So we can make some of these items either required, optional, or actually invisible as well. Again, we had touched on when we were in the patient interface, our family model. So this is where I would be able to see any other family associations for this patient, as well as any upcoming visits, previous consultations, any open consultations that haven't yet been finalized by a provider, and any files that have been exchanged with the patient or internally that is restricted from the patient's view here. Coming back up to the top, so we do have our reporting engine here. Typically, what most people are utilizing here is standard reporting. The top two, patient and clinician, really are enabling you to generate lists of those particular groups. Anything associated with a consultation would be an admin scheduled report. We do also have the capability to save reports. So maybe there's particular data points that you're monitoring or metrics that we're taking a look at on a specific time period basis, weekly, monthly, quarterly, what have you. So that will allow you to save that report so you don't have to come in and build the report from scratch. Some of the data endpoints that we can pull is starting here, and I'll scroll slowly here through the list. Anything with a D in front of it is pulling information with regards to the doctor or provider. Anything with P in front of it is for patient. When we get to S, that will be for scheduled data. And then when you see HP, that will be for health plan or insurance company information if that's been captured within the platform. Once you've selected your desired entry points, then what you would have the ability to do is to build out the report where you could view it on the screen. And then once you're satisfied with all the data there, then you would be able to either download that report as an Excel option or to generate a PDF if desired. Moving on, we have different roles available in the platform. So you can see here, this particular account has a lot of different roles. This is where we can add new roles. Maybe I want to add a role for an appointment scheduler or a medical assistant. So it's very simple. You just type in the desired name and select add role. And then we're able to review the functionality that that particular role has access to and make modifications there if needed, depending on how much data or functionality within the platform that we want that particular user to be able to access. So once you make your selections, you're good to go. If I made a mistake, I want to get rid of this role, I can hit the trash can, or I can simply turn the role on or off here on the right-hand side. On the left-hand side, this is where I can make bulk changes to my roles based on the filters on the left-hand side, or where I can check a particular person off and drag them to a new role to be assigned if need be. So this is kind of my high-level overview of which particular staff members are currently assigned to which particular roles and to be able to change them if need be. The file section, this is really our library, and this is for public facing files. So information that's shared across the platform, no matter who the provider is and no matter who the patient is. So maybe this is an area where we store patient education resources. So information with regards to conditions we treat, or information with regards to certain medications we prescribe. Have to be really careful here because it is shared information across the platform. Definitely don't want to upload any files here with regards to particular PHI, which would be lab results, x-ray results, things of that nature. That is always done within the particular patient's account or within a consultation with that patient. Although we do have the ability to see encounters that have taken place within staff accounts and also within patient accounts, we also have the capability to come into the care history, which gives us access to all consultations based on whatever filter that we're using to display here, no matter who the provider was and no matter who the patient was, and to be able to access that documentation, as well as to add an addendum to a previous consult if need be. The unresolved tab, this is my tickler for any particular consultations. Maybe they had issues, or I was waiting to see if the patient needed to rejoin, if I needed to take an accounting measure to give a patient back a credit, if need be, for a session that didn't successfully take place, where I am able to resolve those encounters if need be. So I can select a status here. These are also configurable within the platform. And then again, if the patient had made a credit um, or some sort of payment, where I could give them back that credit here if need be. Active consultations will allow me to see any of the consults that are currently in progress in the platform. So if for some reason I dropped, I needed to rejoin, where I'm able to view those particular consults that are in session. Open consultations, so we do have the capability to leave our consults open for up to 24 hours. So if our queue is stacking up, we just don't have time to finish our documentation, where we do have the ability to come back and to complete those notes at a later time. Scheduling, again, one of the many places where we can not only schedule new appointments up here in the right-hand section, but also where we're able to manage our availability when we are available for particular service types in the platform, which is the color coding that you're seeing here, as well as the key, which stands for what those particular service types are. So again, you click on the desired particular provider. If they don't have availability in the platform, you simply choose Add New Block. To make a modification to an existing block, you click underneath the red horizontal line here, which is telling us where we're at in real time, and to, again, where you would be able to make a modification to either that existing block, or if the provider has a repeat series on their account. So maybe this particular provider is available every Tuesday and Thursday. I could go ahead and make a modification to that series if need be. This section is also where we are able to view who is on coverage for today and for which service type. This is determined by configuration and how much volume that you expect for your account to bring in. So I can scroll to whatever time of day it is. Once I click on that particular time block, the particular providers that are on for that particular service type will display here on the left-hand side of the screen. And then I'm able to view better information with regards to their availability and schedule an appointment if needed. Okay, a little bit more about the back end. So we're going to go into system settings here real quickly. And we talked about visibility rules when we were setting up the provider's account with regards to licensing, maybe where the patient's located, as well as if the provider is tied to a particular organization or a group. So we can completely control whether a patient can even register for an account, or who that patient can actually be linked up to for a particular visit. So this is where those rules take place and where they can be turned on or off. Over on the left-hand side of the screen, if the account is seeing patients for multiple service types, different services, different time durations, where we would be able to select to add a new service, where we would be able to edit an existing service that's already entered here, as well as where we can assign different times, different names for that particular service, as well as assign different fees if that particular account is collecting through e-commerce in the platform. Over here on the left-hand side of the screen, as you saw when we went through the patient interface, we talked about being able to put as much information or as little information into an intake form here as need be. This is where we create those forms, make modifications to those forms, as well as to assign those particular intake forms to a particular service type. Again, can be as complex as you want them to be, or as trimmed down as you want them to be, or you can complete them, turn them off here if need be. That completes our review of the admin interface, and we hope you have enjoyed our demo today.